Council. I first want to acknowledge the elder for the prayer song and for the prayer itself and welcoming us to this session. You know, when that song is sung, I just, so many times I've heard it, and I just want to say thank you for that. It grounds us and connects us to the land. I'm broadcasting today from Hall Hall in Salmon River. Just behind me is the mountain that was on fire recently, the Halkar Mountain Fire. So it's, as we come into this time all around us, I just want to ground everybody in knowing and understanding that we have lots of things going on in Indian country. And I continue to ask Talkokwi, the Creator, to look after everyone, protect everyone, and continue to clear the path for our people in a good way. Today we're going to be talking about data, and when we speak about data as our people, we don't think about it as numbers. We always think about it as our relatives, our loved ones. So I think it's really important to understand that the First Nations Health Council, the First Nations Health Directors Association, and the First Nations Health Authority, along with our provincial partners, are really sort of bringing things together so data can be utilized in a constructive way for us. Too many times data has been used against us. And I think we have to understand that we can take control of the data and use it to our benefit in terms of trends and where things need to go. You'll hear, I think, from Dr. Wyman about some of those details and understand that it's a way to create a picture for what's going on right now. And as with any picture, we can take control of that and change the outcomes. And I think we have to understand that we have to, we're in a place of a different time right now. We recently had a historic vote on the social determinants of health, the 10-year strategy. In order for that strategy to be effective, this kind of information that's coming forward with the public health agenda will really help inform where we need to go and inform the communities, yourself as Kakukbi, as chiefs, Komipla council members, and health leads and directors as to how we can utilize the data for the health and well-being of your people, your children, and your families. So again, I just want to say that on behalf of the First Nations Health Council and our chair, Wade Grant, just welcome you all to this and just understand that it's a learning process and we're all learning this data together, as I believe is going to be released formally next week. And I think Dr. Nell will speak about that. And again, I'd like to acknowledge Dr. Henry for your continued input into what we're doing here. And for the First Nations Health Directors Association, for the continued work they do on the ground, and all of the staff and FNHA. I just want to thank you for your continued dedication to the health, well-being, and health of our children, families, and communities. So Kokshem, and I'll turn it over to our chair for the First Nations Health Authority, Dr. Sheila Blackstock. Thank you.
Amahu Anashadi Sitsikwik Wilskill Agityan. Thank you all for joining us today. I'd like to thank Elder Sequela for opening us up in such a beautiful way, and to the chiefs and the leaders and the Kakukis online. I honor each one of you and hold up all the work and gratitude to extend your way on behalf of the Board of Directors. And today I'm honored to welcome you to the First Nations Population Health and Wellness Update. And I'll keep my comments short today so we can hear from the Office of the Chief Medical Health Officer and the BC Office of Provincial Health Officer as well, to really learn about First Nations people in British Columbia, to allow this information to flow to First Nations chiefs and leaders and health directors in British Columbia. And as noted already, this data will be publicly released in the First Nations Population Health and Wellness Agenda, the first interim update on August 21st, 2024. So this report follows a baseline report released in 2021 and really provides new data on 14 of the 22 health and wellness indicators. And I just want to echo the sentiments of Winnickstrin, that this is a really safe space for chiefs and leaders and health directors to ask questions and share your input and create a shared understanding around data. So Hamia, and I'll pass it over to the VP of the First Nations Health Directors, Janice George.
Thank you, Sheila. OCM, Nanas Telsqui, Talitza Alis. I am Nanas. My name is Janice George. I'm the health director here at Alis. And I also serve you as your vice president for the First Nations Health Directors Association. And just really honored to be here to, just to share a few words with you all today. In Keith's absence, who's probably traveling around the world somewhere right now. So just happy to be here today, and I'd just like to acknowledge that I'm here on the unceded traditional territory of the St'elis people, and so also acknowledging the territories that you are all on with the utmost respect. My hands go up to Sequoia for the beautiful song and prayer that was shared here with us all today, just really grounding us in a good way. And I'd like to acknowledge Sequoia in our Cholmach ways is my auntie through our spiritual ways. So I love you so much, and I really appreciate the work that you do here with our health teams. Also, the song that was sung, I just want to remind you all, and that my father-in-law could sing. The late Chief Leonard George gifted that song as our anthem to the FNHA, and also adopted the FNHA under the Wolf Clan. So I think it's really important just to acknowledge those things. Also really grateful for, this beautiful team that we've developed and that we maintain, including, just being able to share this way in the safe space, as mentioned earlier, for the tireless work that you all do as chiefs and leaders and healthcare providers in the province. Just acknowledging the health directors, the FNHA, thanking, Colleen. I have Colleen on my notes here, but who took Colleen's place? Oh, Sheila. Okay, I'm sorry. I should know that. So yeah, just thanking you for your words, and also Winnistine. Always very grateful for all of the good work that you do, and I know that you do it with a really good heart and mind. So really thankful for that. And just raising my hands to our BC Provincial Health Officer, Dr. Bonnie Henry. Just great to be in the same space with you today and share this work. To Dr. Nell Wyman, who does amazing work as our Chief Medical Officer. Just a little bit about the FNHA, the First Nations Health Directors Association, was created for the health directors, by the health directors. We are on the front lines, and we kind of operate at all different levels. With our communities and with you all, and just managing the healthcare services. That includes supporting professional development, serving as a technical advisory board to the FNHA and the FNHC, the Health Council, and just informing our work the best way that we can in moving forward. I just also wanted to share a little bit about some of our priorities that we've developed through engagement and through our FNHA leadership. The first one being mental wellness. and with a focus on the toxic drug supply and this overdose crisis that we're in. The second priority is traditional wellness and emphasizing the cultural safety and humility. Also, the traditional wellness is my passion, and that's where I'm really proud of the work that we're doing and really kind of returning to our roots of healing for our people, the things that worked well for us in the past as Indigenous people, just embracing those healing approaches. The third priority, the social determinants of health, with a special focus on anti-Indigenous racism, Indigenous specific anti-racism, I guess I should say. And the fourth priority is health benefits with a special focus on the medical transportation program. So just a little bit of background on some of the work that we're doing right now. And I also just wanted to just say a little bit about data and how, as a health director, how you can use that data and how it's useful to us. And I'm just really thankful for the person who wrote what I'm going to read off here. And I think it's really effective and good information. So I'm just going to read it off. So data is essential for shaping effective policy. It allows us to identify gaps, target resources, and conduct evidence-based, equitable health interventions. With reliable, community-based First Nations health data, we can provide more effective, culturally safe, and appropriate interventions. Policy and intervention based off of this data decreases the risk of ineffective and potentially harmful outcomes. Second, data guides strategic planning, as we all know, by understanding the health trends and the impact of the social determinants. We can develop proactive strategies that support the holistic well-being of First Nations. Third, data is also a good tool for decision-making and a very powerful instrument for advocacy. And finally, data is crucial for the transformation of our health systems. By using data to create culturally safe and inclusive health services, we can build a system that supports the self-determination, long-term well-being of First Nations in BC. And then also just want to acknowledge, you know, the principles of ownership when it comes to data and how we need to kind of, I guess, respect those aspects of data. It would be wonderful if we could have data that's specifically relevant to our communities in this way one day. So with that, I just want to raise my hands to you all and look forward to what we're going to hear next.
Thank you for your opening comments, Winnie, Sheila, and Janice, and especially thank you for the reminder about the gifting of the Coast Salish anthem to us, and a reminder that at the FNHA family, we are all members of the Wolf Clan Takaya Nation. Before we start into the presentation, I just want to give a couple notes of housekeeping. I see on the list of participants, if you have not already done so, can you please identify yourself with a title, either chief or health director, for example, in the name that you have on Zoom. There is some information about how you can change your name if you don't know how to do that. If you're having some technical difficulties, we are supported here by members of our IT team, Andy and Brianna, and they can help you if you ask for help in the chat. And when we move into the Q&A period, if you can invite people we'll invite people who have questions to raise their hands at that time. And also to let you know, you might have seen the reminder that this webinar is being recorded. It started right after the opening prayer with Elder Sequoia, excuse me, and will be available through FNHA following this town hall. So that's about it. We're going to move into our presentations now, and I think I'll just take a minute, and when Dr. Henry presents her part, she can do a brief introduction to herself as well. But for those of you who may not know me, my name is Nell Wyman. I am originally from Mishiba-Witagong First Nation, which is in Treaty 5 territory, part of the Anishinaabe Nation. I'm a psychiatrist by training. Originally, I practiced in Ontario for over 20 years. I've been a member of the FNHA family now for about just over 6.5 years in a couple of different roles, but I'm now very honored to serve as the Chief Medical Officer in the Office of the Chief Medical Office here at FNHA. And so today, both Dr. Henry and I will be presenting you with the information related to the First Nations Population Health and Wellness Agenda. This is the first interim update report. The first full report was published in 2021. And I just want to mention before we start that this work is done in partnership with the Office of the Provincial Health Officer. And I can't say enough about Dr. Henry and what an amazing ally she is to BC First Nations people and other First Nations people in BC, and her tireless work on the public health emergencies and in other critical matters in public health related to our First Nations health and well-being, not only including the incredible work with Dr. Daniel Bain-Smith on dismantling systemic racism and white supremacy in BC. So she's been busy, but she's also been able to join us today. So we're so grateful to co-present this report together to you all. I also just want to take a minute and thank the technical teams on both sides. So both in the Office of the Provincial Health Officer and the Office of the Chief Medical Officer and other teams at FNHA that made this report possible. And there's a couple members of the OCMO team here and Katie Hughes from the Population Health and Public Health Response Team. And we're so grateful for all the work that went into this report. As we start to go through the data, I just want to let you know that we do recognize that some of the information in this presentation can be difficult, can be sensitive, and can elicit strong emotions. Because as has been mentioned a couple of times already, this isn't data, this isn't just numbers, these are people. And who is reflected in the data are BC First Nations individuals, families, communities, and loved ones. So we have a slide up at the end of the presentation that further details some of the, including the contact information of cultural and mental health supports if you need it. You can also be in touch with us if that becomes necessary as well. So I just want to take you through a few slides to show you where we have come from, because it's always important to remember some of the foundations of the Population Health and Wellness Agenda as we move forward through time. So in 2005, the Transformative Change Accord committed the Provincial Health Officer to regular reporting on the health of First Nations people across BC to understand how the health status of First Nations in BC differs from other BC residents. The Transformative Change Accord is a First Nations health plan that identified 7 health indicators to track progress. However, these indicators tended to focus mainly on illness and disease, were what we call deficit-based in general, and did not really look at what keeps First Nations people in BC healthy and well. In response to the work that was outlined in the Transformative Change Accord, the FNHA implemented the only chief medical officer in Canada that works from the governance authority of First Nations. And since then, the First Nations population health reporting has become a shared responsibility between the BC Provincial Health Officer and the First Nations Health Authority Chief Medical Officer. Inspired by the teachings of BC First Nations, FNHA's Chief Medical Officer holds an important role as the watchman who monitors and acts as a guardian of the health and wellness of First Nations people province-wide. In 2014, the FNHA and the Provincial Health Officer's Office signed a memorandum of understanding to formalize our relationship and strengthen our respective and collaborative efforts. And since that point, FNHA and the PHO have been working together to produce and release the First Nations Population Health and Wellness Reports. The Population Health and Wellness Agenda is the next evolution of how the CMO and the PHO are fulfilling those reporting commitments. The baseline report, as you see here, was released in 2021. It outlines an expanded suite of 22 health and wellness indicators from the original 7 that will be monitored for 10 years. And this is the first interim update that we are sharing with you today that provides new updated data for 14 of the 22 health and wellness indicators. This image shows our vision of a healthy, self-determining, and vibrant BC First Nations population that grounds our work. We understand that achieving this vision requires nourishing the roots of wellness, like self-determination and connection to land. It also requires supportive systems that allow First Nations individuals and communities to lead their health and wellness journeys. As such, the report is organized into 3 different themes: healthy, self-determining nations and communities, supportive systems, and healthy children and families. And as has been mentioned, each data point is honored as representing a strong, resilient First Nations individual who is a member of a family, community, and a proud nation. The PHWA partners are committed to presenting data in ways that are wellness-based, decolonized, and grounded in First Nations people's teachings, perspectives, and values, that explicitly acknowledges the experiences, resistance, and resilience of First Nations people in the face of persistent and ongoing settler colonialism, Indigenous-specific racism and discrimination, and that honors First Nations self-determination, data governance, and truth and reconciliation. And I'll turn it over to Bonnie to introduce herself and carry on with the next few slides.
Thank you, Dr. Wyman, and thank you. It's an honor to be here with you today. I want to thank Elder Sequalia. It was so lovely to see you again, even virtually, and for your words and opening prayer here. I serve as the Provincial Health Officer here in British Columbia, and I have the privilege today of speaking to you from the traditional and unceded territories of the Lekwungen-speaking peoples, the Songhees and Esquimalt First Nations here in what we call Victoria. And as Nell mentioned, this is one of the most important relationships our office has, and it's something we are committed to. And we're committed to doing our job, and as a settler in this country, committing to understanding the actions that we can take to undo the white supremacist systems that we work in, and unlearn some of the ways that the work that we do, or the systems that we are in, disadvantage Indigenous peoples and First Nations peoples. I also want to acknowledge that First Nations territories encompass BC First Nations territories, encompass every inch of this province, and that the inherent rights to these lands are rooted in connections to lands and waters. And I'm going to talk a little bit more about how important that aspect is in the work that we're doing in my office and in this interim report. And we heard already today about the effects that the fires and landslides and floods are having on the ecosystem that we live in and that are so integral to First Nations communities in this province. And so I think the data that we are presenting today is so important for helping tell the stories. And when we tell those stories, we can take actions to improve things and to support the things that do allow for wellness. What else did I want to say here? So one of the things that Janice George talked about was, having data as being a good tool. And what we know from my Western way of thinking is that good data is a good tool. And what we are working through with this health and wellness agenda is to try and get data that allows you to know what's happening with your communities and your people so that you can use it as an important tool for advocacy, for making change, and for improving the health and wellness. And one of the measures that we have come up with in this new way of looking at things since 2021 is how do we actually measure healthy self-determining nations and communities. And this measure in itself, this connection to land, is something that is very challenging to understand. So we reported, we'll be reporting in this interim report, one of the things that we did in a partnership to try and understand this whole concept of self-determination, culture and language, and how that can form the roots of wellness for First Nations people in BC. So if we go to the next slide, what we're reporting on and what will come out to you today and to the public next week is a really important project that we worked together on. It's called We Walk Together, and some of you may have been participants in this project. It is, we sought to explore BC First Nations perspectives of their connections to land as a determinant of health and wellness through land-based gatherings and sharing circles, with knowledge keepers and youth. And I think this was such an important, valuable experience to have both knowledge keepers, elders, and youth together having these sharing circles and these in collaboration, these gatherings. So the project took place in 3 distinct territories. The gathering in the Fraser Salish region was conducted in Stolo territory with participants from 7 of the Stolo nations. The Vancouver Coastal Gathering took place in Lil'wat territory and had 35 participants representing all 14 First Nations in the regions, and I was privileged enough to participate in Lil'wat and to visit the territory. And the Northern Gathering took place in Lake Babine Nation with 11 participants from the Babine Nation. And again, I had the privilege of spending time in Lake Babine to understand a little bit more about the importance of these connections. So this was really an eye-opening experience. I think I have heard from all of us who were involved. It used an exploratory two-eyed seeing approach, and a two-eyed seeing approach comes from Mi'kmaq elder Albert Marshall from the east coast of Canada, from the part of the world that I grew up in, and he talks about the importance of taking the best of both worlds, that what we can learn from Western medicine, and I can provide some support on that side, but also importantly, holding up as equal and equally important the knowledge and wisdom of Indigenous and First Nation specific learning and knowledge. So we did, using this two-eyed seeing approach, we followed nation-specific protocols in each of the 3 areas, using sharing circles, land-based activities like medicine walks, fishing, canoeing, dancing, drumming. We had a river walk. The team combined the strengths of Indigenous and Western methods by using film. And so this was recorded as a form of oral and visual storytelling to share the learnings from the participants in each of these circles, in addition to a written report, and that written report came out recently. So if we go to the next slide, this is what came out of this. This is our first attempt to work with community to understand how we can show meaningful change and improvement in being able to connect to land, water, and territory. So we released the final research report in April of 2024, just this year, and you have access to that. And it details how the research was done, what was learned from knowledge keepers and youth, under 3 overarching themes. And those themes were ancestral knowledge, land and water wellness, and accountability. And this is a very important report, and I encourage you to have a look at that and see what you can learn from it as well. The other part of this was doing videos, and you can see the opening of the 3 videos here. So these were developed from each of the regional gatherings and include important discussion and footage of the land-based activities. And we went to each of the regions as well and had validation gatherings. And participants told us how important it was to them to have this knowledge captured in a video format, that it could be used, and I hope it will be used, for education, for community planning, as a way of sharing perspectives with others, including governments and our Western world and other organizations. And so the plan is for First Nations Health Authority, and Nell and her team will be releasing these videos at the fall caucuses, and then we'll make them public online as well. So I think this was the first part of how we can work together to really show the wellness part of Indigenous knowledge and how that can help build wellness and health in the future. And going on to the next slide, the second part of this report talks about supportive systems. And these, again, tell us the data that comes from this, and I'll show you that in a minute. Supportive systems such as health, education, and housing must honor and uplift First Nations' way of knowing and being. And it's clear from the data I'm going to show that our systems are not meeting these obligations to First Nations people in BC. We've had some small success, and the next slide shows a little bit of this. One of the measures, we can go to the next slide. One of the measures that we've been following over time since 2008 is the proportion of students who complete high school within 8 years of starting grade 8. And so from the percentage of Indigenous students who completed high school within 8 years has increased. And this is a statistically significant increase. So that tells us that the data is meaningful. It's not just by chance. And I think that's a good thing. It tells us this is self-reported Indigenous students, and it includes public, private, and First Nation schools located away from home and home communities, but does not include in-community or on-reserve schools. So as such, many First Nation students in BC aren't represented in these data, but I do think it is a measure that we can show that when we take certain measures to make school more relevant and accepting for Indigenous students, it can make a difference. The next slide is the other indicator that we have is avoidable hospitalizations. And so this is kind of a complex thing, but this really measures the types of illnesses that are common that most people can deal with at home. So these are related to conditions that can usually be well managed in home or in community, and doesn't typically require hospitalization unless it becomes out of control. And so really it's a marker of the system. Do we have systems in place in communities that serve First Nations that allow them to get the care that they need in their community? And this tells us that we are not doing a great job in that, and that the systems are still not able to support people to get the care they need in their community or at home. And so we've seen not much change in this over time, and this is an area where we can really focus attention on what we need to include in community to ensure that people aren't needing to go to hospital. And I don't need to say it here, but I know that much of this is because healthcare services may not be safe for many First Nations community, and we saw First Nations people. And we saw that vividly in the In Plain Sight report. So there's work we need to do within the system to make it more accessible and available to First Nations peoples. The next slide talks about First Nations healthcare providers, and again, the proportion of First Nations physicians in BC remain less than half of 1% of all BC physicians, while First Nations people make up between 3 and 4% of our population. So again, it tells us that in this very important marker of being able to have a system that responds to needs in a way that is safe for people, that we are underrepresented still. I will say that I'm really ecstatic that 2 of the BC First Nations physicians are working in my office, Dr. Danielle Bain-Smith and very recently Dr. Shannon Waters from Cowichan Nation, who are both committed to looking at how we can make it a safer place for First Nations physicians, midwives, and nurses in this province. So I'm going to leave you with that and turn it back to Nell to talk about some of the other indicators in this report.
Great, thank you for that, Bonnie. The next slide, please. So the next section in this report, the indicators measure health outcomes with the vision of healthy, vibrant First Nations children and families. Findings in the report show limited improvement overall, and some indicators showed concerning worsening trends. And one of the most concerning trends that's noted in this report is the significant decrease in life expectancy among First Nations people since the baseline report. We have already released the life expectancy data previously publicly, initially to BC Chiefs and Leadership in another virtual town hall several months ago. And it's important to recognize that these changes have happened in the context of the 2 public health emergencies that we have all experienced over the last several years, the COVID-19 pandemic and the toxic drug crisis, which is still a public health emergency and is into its 9th year. So we'll go through some of these indicators together. The first one is healthy birth weights. And this refers to singleton babies, live singleton babies with birth weights between the 10th and 90th percentiles. And what that means is it kind of leaves out the sort of the babies who are born at the more extreme weight ranges. And singleton means single birth. So this would not include, for example, babies who are born as twins or as triplets, because oftentimes multiple births results in babies who are a little smaller just because of the fact that they are multiples. So the percentage of status First Nations babies born at a healthy birth weight in BC has not changed substantially in recent years, though it did decrease from 73.8% at baseline in 2017 to 72.1% in 2019. And so as we go through these different graphs as well, I'll just point out as you take a visual look at the graphs, status First Nations are the red lines typically in these graphs, and other residents of BC are typically the navy blue. So you'll see that there's a gap between those 2 lines, and that's what we're talking about. And so for healthy birth weight from the initial baseline report, this health indicator seems to be worsening. The next slide shows infant mortality. And we know that many infant deaths are preventable. Infant mortality is associated with the social determinants of health, things such as poverty, food insecurity, unemployment, inadequate housing, lower levels of parental education and income, and lack of access to healthcare. So for this particular indicator, again, we'll ask you to look at the red line toward the right-hand side of the graph. And you'll see that there has been a lot of variation in infant mortality rates among status First Nations people in BC over the past 30 years. But the general pattern is that the graph has been on a decline, especially in recent years. So from the baseline report, which reported 5.3 infant deaths per 1,000 live births in 2013 over 2017. So this is 5-year blocks at a time. The trend continues downwards. For this first interim report, the infant mortality rate is 4.6 per 1,000 live births. And we would judge that this indicator has improved over time. The next slide is youth and young adult suicide rates. So we refer to the youth young adult population as being between 15 to 24 years of age. And you'll also see it's very small print on the slides, but these are also 5-year aggregates, meaning the graph, each point on that graph as you move from left to right is a 5-year period that changes every year. So the baseline report is highlighted there as 3.1 per 10,000 people over the year 2013 to 2017. And you'll see from the very far right-hand side of the graph at this first interim update, the suicide rate for young people, youth adults is 2.8 per 10,000. So we would gauge this particular indicator as having no or minimal change. I will note that suicide deaths in First Nations communities also reflect the underlying impacts of ongoing settler colonialism and settler colonial harms, including racism and discrimination, socioeconomic exclusion, intergenerational and experiential contemporary traumas, forced relocations, collective suffering, and other injustices. But I will actually highlight some of the work that is happening in different communities and regions across the province in terms of the work that's going on, not only in suicide prevention, but what is called life promotion. And that work will continue as we go forward. So the next slide shows diabetes. This is the age standardized diabetes incidence rate. So these are new cases of diabetes being diagnosed. And you will see from the red line compared to the blue line that there has been an increase from the baseline report. The baseline number was 8 per 1,000. And in this first interim update has increased to 8.5 in new cases of diabetes per 1,000. The diagnosis and onset of diabetes is known to be associated with a number of different factors, including intergenerational effects, but I would also say related to the social determinants of health as well. So factors such as poverty, food insecurity, food availability in different communities, whether they're rural and remote, the types of choices that people have, and whether people are engaging in gathering traditional foods, either through, for example, fishing, hunting, gathering, berry picking, etc. And we know that First Nations people are reclaiming traditional knowledges and practices of healthy eating and living to support holistic health to both prevent and manage diabetes. And what I'll also say is our office at FNHA is working on a diabetes report specifically. It's not quite ready for publication. We are aiming for later this calendar year or perhaps a little bit into next year. So the next indicator, the next slide, is serious injuries. And this indicator captures the rate of serious injuries, including hospitalization. So this could include both unintentional injuries, things like serious falls, motor vehicle accidents, and intentional injuries, meaning injuries that happen related to interpersonal violence and self-harming behaviors. And again, this rate is very much related or associated with the social determinants of health and wellness that we've already talked about to a certain extent. it could reflect the greater likelihood of people working in high-risk industries and can be linked to heightened rates of serious injuries requiring hospitalization. So the rate at baseline from the data is from 2017, 2018, but is present in the 2021 first full report of the Population Health and Wellness Agenda was 31.4. And in this first interim update is 31.1. So really no or minimal change in this health indicator since the first baseline report in 2021. The next one is living long lives, which is the indicator indicating life expectancy at birth. This indicator reflects the number of years that a person is expected to live at the time that they are born. And life expectancy at birth for Status First Nations people in BC decreased from the baseline of 73.3 years in 2017 to 67.2 years in 2021. So the first baseline number was part of the first full report of the Population Health and Wellness Agenda, and this is the number 67.2 for the first interim report being published this year. And we have already shared this particular indicator with BC Chiefs and leadership in a previous town hall. But we can say that what has driven life expectancy down is partly due to the COVID pandemic, but is also more related to deaths related to the toxic drug poisoning crisis public health emergency. And we know from other data releases that First Nations people continue to be disproportionately represented in the toxic drug crisis compared to other residents of BC. The next indicator is mortality rate. So this is from all causes, age standardized. The age standardized all-cause mortality rate for Status First Nations did, as you see, trend slowly upward from 2011 to 2018. But then the upward trend was halted for a number of years, 2017 to 2019. And then as you'll see, looking at the red graph on the right-hand side, there has been a much steeper upward trajectory in mortality rates. And again, we know that deaths related to the unregulated drug toxicity, toxic drug crisis increased considerably in 2020 and 2021. And these were also the first 2 years of the COVID pandemic. And has been mentioned, First Nations people are disproportionately represented in those numbers. So the baseline report would state the number as 117.3 per 10,000. And it has increased to 156 per 10,000 people in this first interim update. So we have labeled this indicator in red, saying that the indicator is worsening over time. Next slide, please. So what both Dr. Henry and I have shared this afternoon is kind of a mixed picture where some of the indicators have shown improvement. Some indicators have shown no or minimal change from the first full report, and some indicators are clearly worsening over time, which is concerning. And we are carrying over actions to nourish First Nations roots of wellness from the baseline to this first interim update to emphasize their importance and to highlight that system partners are not yet fully meeting their obligations to contribute to improving the health and wellness of First Nations people in British Columbia. And you will see them here. They involve, I'm not going to read every single bullet point, but these actions talk about the right, First Nations rights and right to self-determination, upholding data governance principles, being able to catalyze with our partners actions to build supportive, anti-racist, trauma-informed, culturally safe systems, with particular attention given to connection to land, advancing these roots of health and wellness for the next generations, embedding wellness approaches in policies, programs, and services, committing to cultural safety and humility by eradicating Indigenous specific racism, and increasing access, good relations, and attachment to primary health care. And we also have our First Nations Primary Healthcare Initiative going on in the work with First Nations Health Authority and our partners. So to let you know, this first interim update according to our data governance principles has been shared with you first today, BC Chiefs, leadership and health directors. And this interim report, the first interim report, will be released publicly in a media event next week, next Wednesday, August 21st, in downtown Vancouver. And while there are many findings in this new report, some of our key messages will focus on the significant and disproportionate impact of the toxic drug crisis on First Nations people in British Columbia. So I will stop there and want to thank everyone for their attention as we have gone through this presentation. And we are going to move into the question and answer period of this town hall. I will turn it over to my very valued colleague, Katie Hughes, who's the VP of the Public Health Response Team here at FNHA. And as we do that, I will just show you this slide with the mental health and wellness supports. And I believe that the numbers, the contact information for all three of these supports have also been put into the chat. So I'll turn it over to Katie.
Dr. Nell. Good afternoon, everyone. My name is Katie Hughes. I am a white settler of English and Irish ancestry, and I am an uninvited guest on the occupied territory of the Coast Salish people, the Musqueam, Squamish, and Tsleil-Waututh. As Nell said, I serve as the Vice President of the Public Health Response here at the FNHA, and I appreciate the opportunity to free up Dr. Henry and Dr. Wyman to be able to answer questions by just moderating the Q&A. So if you have a comment or question, as Dr. Nell referenced, please raise your hand and we'll move through as many people as possible in the next 20 minutes or so. We will give priority to chiefs and leaders in terms of the questions. Once you come off mute, if you could please restate your name and the community you're from or the nation, that would be appreciated. And we'll start off with Cook B. Robbins, who has been extremely patient with his hand up for quite some time. So over to you, Cook B.
Wait up. Can you guys hear me okay? 5 by 5?
All good.
Okay. First of all, I'm going to apologize in advance. I am going to get emotional here. For the past 2.5 years, I have been part and parcel of an education program that has experienced racism and discrimination right through the system. We've gone through the system twice. I've met with the minister twice, each time saying we're going to get to the bottom of this. And now the investigation has turned into a review, which pisses me off. We've had instances in the classroom where children have been put into a corner and the teacher says, we will call that the reservation. I have teachers responded to students who are waiting for their parents to pick them up, where the teacher tells a student maybe they went to St. Joseph's Mission Residential School to look for you. I've had instances where teachers that our language teachers are in the boardroom and other teachers are saying they're not qualified to be teachers. Why should they be in our union? I've had instances time and time again, and this has been going on for decades. This isn't something new. I am really frustrated with this whole system. And I'm really glad you said something there, Dr. Henry, because I think it's important that, you talk about the white supremacist system. And that's what the education system is. There's no way you can deny it. You can go through trustees, you can go through the school board. By the time you get to the school district superintendent, it's an all boys club. They got each other's back. They could care less about what's happening to our students, let alone our teachers. Now I'm getting to a point now where I'm ready to go to media. I'm putting everything out there, and it's 2.5 years of frustration felt by not just our staff, our students, and looking at the information that you shared, I believe it was on slide 10. And that information is, I have to say, I think is wrong. It may be good across the board, but when you look at the independent school districts with the education program, Williams Lake it looks great from the outside, don't get me wrong. You drive up to a school, wait, you see the Sequepan flag hanging, you see the nation's flag hanging, it looks really great. You walk into the hallways, you see the language there, Chilcotin, the carrier, the Sequepan. You see it in the hallways, you see the First Nations role models. It looks really great. But when you're in the classroom or in that staff room, it's a different story. A lot of times I'd stop into the high school in Williams Lake, just out of the blue, just stop in just to see what's going on. I'd say probably 70% of the students wandering the hallways are First Nation. And the reason why they don't want to go to the classroom is the teachers don't even acknowledge the fact that they need help. Why should they go to a classroom if they're not going to get the support they need to be educated? This whole system, this whole education system needs not more than just a review. It needs an investigation. First Nations teachers, First Nations students, they don't have anyone that they can rely on to represent them at that level when it comes to racism and discrimination. It has to stop. Enough's enough. Decades and decades, probably even the past 150 years of racism and discrimination of First Nations people. Thank you, Dr. Bonnie Henry. Thank you for saying it's a white supremacist society. But how do we change that if we don't have solutions or a person that we can go to that can provide us a solution? I've gone through every step, believe me. I've treated this system, I've gone through there, I've cut the red tape, I've jumped through their hoops, I've got as far as the Ombudsman and to the Minister of Education, Child and Families, and still nothing is being done. They keep fluffing it off like, oh, they'll disappear. They've been at it for so long, they're going to disappear. Well, I'm sorry, I can't do that. I'm talking about the future of my community, the future of all the children in BC. And I have to say that I am a staple in the education program. I'm the one that started the residential school curriculum development in School District 27. Now it's across Canada in grade 5 and grade 10. I was the one that was there when Orange Shirt Day started in Williams Lake. In Williams Lake, and still the racism discrimination is alive and well. BCT, they need to look at their policies. They need to change that. It's for far too long. It's the First Nations doing all the reconciliation. When's the province going to step up and do something? Rather than just throw policies and procedures in our face. Enough's enough. I need the support of mental wellness to start moving this forward, because for far too long, our students are being ignored. I spoke to one of my staff. She's 35 years old. I spoke to her. She's got 3 kids. And I asked her out of the blue, can I ask you a personal question? She's like, she hummed and hawed, and then she's like, sure. And I said, did you experience racism and discrimination when you were in school in Williams Lake? Without a doubt, she said. I was bullied by teachers and other students, and nobody supported it. Nobody there to support it. You know, our counselors, they have a voice for our students, but it gets so far and then it's stopped solid by the school districts, the superintendents. That old boys club needs to be broken. And we need a process. You know, we're all here for the mental wellness of our future. These are our children we're talking about that are being racist. They're being taught by racists. They're being bullied in the classrooms. They're being bullied in the hallways. And you wonder why we have so many gangs in Williams Lake. They do it to protect themselves from being bullied by other students. You know, something's got to change there. Something's got to change there, and I'm really glad I'm on this call because I am so upset and so frustrated. I've been at this for 2.5 years. I've had a teacher that's been at it for 3 years, trying to punch through on discrimination because he's got his master's degree, but he was all but ignored for any other positions for principals. You know, so I think we're on the right path. I want to thank you for the data, but again, I have to say we need to start looking at data in education with the same way that we did with the in plain sight. We need to get some First Nations together to start doing the research and start looking at this because it's not a healthy place to be as a student. And we have some students, for example, that are freaking smart. They know calculus at grade 10. They're doing algebra. They're doing it all. And then they go to register for classrooms. And the people are telling them, well, if you take trades math, you can graduate. You're guaranteed. They don't challenge our students. They just try to push them through the system as long as they get the money. You know, that nominal roll. Well, I'm going to hold all my students back until the end of September 30th, simply because I am getting so frustrated with this whole system. So, you know what, I apologize if I offended anybody, but this has been going on long enough. And I needed to voice my opinion when I heard you talking about our youth and the mental wellness. It's starting in that education program. That's where we need to start. That's where reconciliation should begin. But First Nations don't have a voice. No, they don't. We need something there that First Nations students, First Nations teachers, they need to have someone there that can back them up against the old boys club. So I just want to thank you all for your time. Goksham.
Thank you. I wonder if I can just say a few things quickly, and thank you, Robbins. I hear you, and I think that is the power of some of what we have in this data, because it was page 9, and we'll share this with you. It's improving, but it's not where it needs to be, and so we can use this to say, you know, exactly what you're saying. We are making a difference, but not enough. And it's the work that you are doing that's making that difference. So we can use this to show how we can support you. And I hear you absolutely, and I've heard it from many, many young people in the school system. So we're here to take this message and to use this as one way of trying to make change in the education system, which is absolutely needed. So thank you for work that you do. It is making a difference, and we'll do our best to try and help you.
P. Robbins and Dr. Henry. Dr. Nell, is there anything you wanted to add?
Yeah, thanks, Katie. I think what I'll just say in general, as we went through the different indicators that are in this first interim report, I think it's pretty clear that in the different major systems like education and the health system, that, a lot of the challenges stem from that underlying racism and assumption of white supremacy. And that there are many ways in which we are disadvantaged compared to other residents in BC. Could be Robbins, I really appreciate all of your comments because I think they're quite accurate. And we know that racism in the educational system is also, we know that, right? And we knew that even before in plain sight. We knew that racism was widespread in the health system, but in plain sight sort of documented it and was at least one tool that we leaned on in order to try to move things forward. And it's as subtle as you say, it's not just sort of that those brazen, I suppose, ways, sort of things that are racist, but it's even lower expectations being put on First Nation students. I remember, I'll just be really brief and then we'll turn to the next question, but giving a presentation to elementary age First Nations kids from grade 5 to grade 8. And we had a really interactive session, with videos and music and movement. And the teachers at this one school said to us, the kids can't sit for that long. And of course they could, but they'd never been given that opportunity because people make those assumptions right from the start. And partly the reason why we see such a terribly low rate of First Nations physicians in this province is partly because people don't have the background to qualify for a career in health. But when they even get into those health education programs that they also experience a great deal of racism. And even as, an older First Nations physician now, I still experience racism amongst my peers. So it's a giant problem and we cannot forget that. And we have to keep always fighting against it.
Just can I just add another comment to that? I thank you for your words. First of all, it's great. It's not great to know, but I'm sure you have a process and you have someone that you can call as an HR person when you experience something like that as part of the system, First Nation system. But when you're in that white supremacist system, First Nations don't have that. They don't have that HR that they can go to. They don't have that support services that they can rely on to back them up. Basically, they're bullied out of their positions. And I've seen it. I have 32 letters from different teachers and students being bullied out of a classroom, being bullied out of their positions, and forced to take a severance simply because they stood up to the superintendent or the school board or to the trustees, and they voiced their opinion around racism and discrimination. This is more adamant for the rural and remote communities. A lot of the urban First Nations that work with the school district are good friends with a lot of the politicians in these municipal areas. It's like their eyes are closed. But when you're a rural and remote community and your student comes back and you're talking to them and they're saying, I don't want to go back to school. Why not? Because they don't treat me good. The students are bullying me. The teachers don't care. So the parents are wondering, well, who do we go to? And that top of the totem pole is the chief, and I'm getting calls. Like I said, I have 32 letters, not just from students, but from teachers that were bullied out of their positions. So, there needs to be something solid there for them, and I just want to thank you again, for hearing me. Cook Shem, I'll stop it there.
Thank you, Cookie Robbins. See a hand up next from Health Director Charlene Webb, and if you just want to introduce yourself, Charlene, that would be great. And then if we can be fairly brief, we just want to make sure we have time for your question and some responses before we have to close up.
Hi, thank you. My name's Charlene Webb. I'm the health director for Kitsim-Kalem. We're located 3 kilometers outside the city of Terrace in the beautiful Tsimshian territory. I'm a carrier living in this area, living and enjoying my life. My hometown is Fort St. James. Before I start, I'd like to acknowledge some of the things I'm going to bring up may be triggering, and that is not my intent. Phone numbers have been shared with us to call. Please reach out. I have been seeing in the community of Kitsim-Kalem an increase in cancer patients being diagnosed at stage 4. We need more screening opportunities and some statistical numbers. My own cousin, May 21st, was informed that she had liver cancer. 51 days later, July 10th, we lost her. She didn't get an opportunity for treatment. She didn't get an opportunity to discuss what chemotherapy would look like. But she had 2 doctors, an oncologist, and somebody finally picked her up as a family doctor. The reason I'm sharing about my cousin, because she lives in the city of Terrace. And we need a voice at the table for off-reserve members. So she had 2 doctors telling her 2 different ends of the spectrum. One, you're going to make it. We're sending you to Vancouver. You're going for a liver transplant. That's the family doctor. The oncologist telling her and me and her kids that this is stage 4. There's nothing we can do. That's really hard. It's been 1 year since we lost her. The kids are still struggling. Since we've lost her, she had 1 more brother diagnosed with cancer. Again, off reserve. So if we look at these numbers, the question is, or not so much a question, but we need more screening opportunities. Yes, COVID put a big hiccup in our life, but now we got lots to do ahead of us, and screening opportunities to isolated, semi-isolated rural communities is critical to fight this ugly disease. The second question I have, my staff and I have taken the coroner's report offline and read and talked about the opioid crisis, right? This one hits hard, and it's not my intent to hurt anybody. Because I'm no stranger to losing family to this opioid. But my nephew lost his life at the hands in the emergency hospital. They gave my nephew Ativan, which is a downer, when he was on cocaine, which is an upper. And the report we got back from the coroner was he died from a massive heart attack. And that was drug-induced cardiac arrest. And when we read the coroner's report, there's 2% of people dying in the ER. Out of that 2%, how many of them, all they had to do was wait for his blood work? All they had to do. And then you determine how to treat the patient. So with that piece, nobody's talking about that. Nobody's talking about the ones we lose in the hospital. Why did we lose them? Were they administered drugs that they shouldn't have been administered? And who's governing those that administer those drugs? Again, this is very heavy. I know it is. I encourage you to reach out to the numbers provided to all of us. Thank you.
Thank you, Charlene. Dr. Nell, do you want to make any comments?
Yeah, just before I start answering, Charlene, first of all, I just want to express my condolences for the losses in your family and recognize that, you know, many people on this call have losses as well. I wasn't 100% sure if Wennick Jean had something. Also, I saw maybe his hand raised. No, okay. What I will say, you know, part of the value I believe in presenting this data to you all and having, you know, it'll be downloadable as a PDF, for example. You know, you can use this report and the baseline report in making community health plans, community health and wellness plans, and developing programs that are going to be helpful for your communities or sub-regions, regions. That's partly why we have this responsibility over time to continue to share data and information. And the other thing specifically I'll say, Charlene, is we have a partnership with BC Cancer, and it's timely that you raise the issue of cancer screening and cancer screening rates for First Nations, because we're actually in the process of planning another virtual town hall to present that data to you, to BC Chiefs, leadership and health directors, probably around the end of September, early October. And we're going to have Dr. Nadine Caron there as one of the presenters to share that data around screening rates. And so hopefully have a discussion at that time about how we can bring those screening rates up. The other thing that I was going to say around, you know, with the coroner services, we have a very good partnership with the BC Coroner Service. Even though the chief coroner, the previous chief coroner, Lisa Lapointe, has retired, we continue to work away at that partnership over time. So, you know, when there are specific questions.
I can't hear you.
You've gone on mute somehow. There you go.
Sorry about that, Charlene. We have some contact information that the BC Coroner Service has given us that if families have particular questions when they get reports or they request copies of reports, that you can connect with a coroner in your region, and they can walk you through that and help you and the family understand if you need that. So we have that information. And I'll just try to remember where it is and dig it up. But I know that they did provide that to us.
Okay.
Thank you, Dr. Wyman. Dr. Henry, is there anything you wanted to add? No, you're okay. I appreciate that we are very close to time. Thank you very much to everyone for your participation on today's town hall and the questions that you raised. And I also want to say thank you before I turn it back to Wennick Jean. Thank you to Dr. Nell and Dr. Bonnie for really holding this space and for your advocacy and your leadership. It's so clearly needed from what's been shared today and into the future. So Wennick Jean, I will turn things over to you, please, for some closing remarks.
Katie, thank you very much. Dr. Nell and Dr. Bonnie, thank you for the presentation. You know, Cook, Fred and Charlene, when we the pain of our people is really evident, especially when we see it in the form of our children or our family members. And that's why I think it's really important the data we're seeing and hearing today will transition this information into our regional caucuses so we can have a more fulsome discussion as to what we need to do. Because Cook be Fred, you're right, it's a systemic problem. It's the whole system is racist, not only in education, healthcare, even in these corporations like BC Hydro and places where our young people work. It's the racism, unfortunately, is embedded in the system because of the colonial sort of construct. And I think on the health side of things, and I think that the VP for the Health Directors Association talked about it, we really need to, Janice had talked about, we really need to invest in our own ways of doing things, our traditional knowledge, our traditional wellness, our ceremonies. Those things that we've had for thousands of years, bring them back to life, because that is something that an institution that's a white-based white supremacist institution can't deal with because they have no knowledge of it. We have knowledge of that. And that's what our people are looking for. So we have to find a way, how can we utilize sort of common and sort of new sort of technologies and process to inform us of what we know to be right. Because evidence-based research really is telling us what we already know. The evidence tells us things. We know that the land heals. We know that the water heals. We know that our ceremonies heal. We know that our songs heal. We know that these things, the foods, are a part of our nutrition and nourishment, the animals, the fish, and on and on. All our teachings from thousands of years, we have to bring back to life. And in this in sort of the context we're in today, we really have to understand we're dealing with a system that has no knowledge or willingness to really change. There are people like Dr. Henry, other people like that within the system. And I know that Dr. Henry's come under a lot of fire from people. And I want to appreciate what you've done, Dr. Henry, saying for what you've said about the system being a white supremacist system. And I think it's hard for people to hear that. And I think that you even mouthing those words in a public way and from your office as the public health officer really contributes to where we need to go. It's about transparency and honesty. And reconciliation is not about us doing anything, it's about the system changing. Our old people tell us that reconciliation is not about us. We did nothing wrong. We lived our lives and all these things were imposed on us. Now we're having to recreate what we know works. And it's our way of being, our way of life, our language, our culture, our connection to land, all of those things. And it's really our job is to transmit intergenerational healing, not intergenerational trauma. And I think that as we use data, we can use it in such a way when we go into the fall caucuses to have a fulsome discussion. Well, how can this lead into other things we need to do with the social determinants? Because it's not just health, it's education, it's employment, all the things we've talked about here. So how do we do that in a constructive way to really make a difference for our people in our communities, for those people that quote in this whole sort of paradigm of on and off reserve, it's a genocidal process that was created by the Indian Act. We have to stop thinking like that. There is no on and off reserve, they're just our people. They choose to live either in our territory or other territories. And I think those kinds of things have to start changing because the Indian Act has done so much damage, we have to turn things around. So again, I want to thank everybody for participating. So as we transition into the fall and the fall caucuses, we continue to harvest for food, the four-legged. I ask that everybody be safe and continue to look after each other, look after your families. And most importantly, pay respect to those things that are consultant, our relatives. Because without our reciprocal relationship with the four-legged, the finned ones, the water and all those things, we wouldn't be here. We have a relationship with them that's taught to us. We respect them, they respect us. And so that's what we need to do in this. And I think what we're beginning to learn is the Summit way or the white way of doing things. They have to understand we have to respect each other. And that's difficult at times because it's hard to hear and feel the racist things that happen because every one of us continue to experience racism in one form or another. And it happens all the time. It's happened to myself, it's happened to my sons, and these are not isolated incidents, they happen all the time. So I just want to thank you all for your time here today and thank again the FNHA staff, you know, our chair, Dr. Sheila, our vice president for the First Nations Health Directors Association. And again, Dr. Bonnie and Dr. Nell for your presentation, but most importantly for the Kukukpi, take care of yourselves. Don't become so burdened with the pain of your people that you don't look after yourself. Because if you don't help yourself, how can you help others? And so is help yourself so you can so you can help each other. So I ask that the health directors and the Kukukpi and health leads that you look after yourself. Take time to look after yourself. Not much good to anybody else if you cannot look after yourself. And so I want to thank you all for this opportunity. Remember, we're transitioning into the fall caucuses and have a more fulsome discussion on this data, because this data is our people and we have to find a way to turn things around. So Cookscham, thank you.
Sheila, would you like to offer some words?
Sure. Thank you, first of all, to Kukti Rollins for sharing the current reality of your community and the heartache, and for providing the context of the impacts of data, good data, and the realities that we have to move forward grounded in, as Winnickshun so eloquently summarized, grounded in the First Nations social determinants of health, and to decolonize and disrupt the healthcare systems that have taken our holistic perspective of health, our traditional ways of knowing and being, and siloed them into separate approaches of approaching our health from different avenues. And I'm thankful and honored to be a part of this work and the Health Council's vision of the social determinants of health, of bringing it back to a holistic perspective of the social determinants of health, grounded in self-determination, language, culture, to really address these important issues that, such as Kukti Robbins shared with us today, racism in education, and as well as what Charlene shared in terms of barriers to access to healthcare and different experiences of healthcare from different perspectives, in terms of being told one thing on the one hand and something else on the other hand, resulting in huge trauma to our families and our communities. So with that, I'd like to say thank you to the Chief Medical Health Officer's Office, as well as again to Dr. Bonnie Henry for your exemplary work as an ally, and a true ally. From the bottoms of our hearts, thank you. And I want to thank each one of you on this call today for your leadership in your communities and everything that you do every day in terms of improving the holistic health outcomes of our peoples. And so I'll pass it over to Janice George to close. Thank you.
Thank you, Sheila. So I'd just really like to raise my hands to everyone who participated here today. And for those of you who shared, your deepest feelings and emotions, it's really important that those things come to light, because we can't hide how the impacts that, all of these things have on us. I really just want to acknowledge the approach taken here with the sharing of information and the data. I was really pleased to see some of the comments of Dr. Bonnie Henry about the approach and the land-based and culturally appropriate, the videos. Just kind of, it really gives us a way to connect the data to ourselves and apply it in a meaningful way. So and just knowing that you shared this with us first and we didn't see it on the news or some other way, I really appreciate that, and I really appreciate the FNHA for doing that, and also for the way it's been shared by Nell and Bonnie. So I'm just raising my hands to you. I can't I can't deny I feel really disappointed in seeing some of the data and the things that are, have worsened when we just put so much into our work to try to better the health of our people, at all these different levels on the ground level, at the leadership level and at the provincial level like this. We just put so much heart and soul into our work, and then to hear these, that everything's are worsening in so many areas. I felt really disappointed. I thought it would have been different, but it just kind of brings me to, like, how do we analyze data? And we could look at all of the tangible factors, but we should also remember and consider where we're at right now. With the residential school, like the findings of the 215 and everything that followed that, and the day schools and the claims process and all of these things, the drug crisis we're in, COVID, the impacts of COVID and on inflation, and that leads to poverty, and we don't even barely have fish in our river anymore, and our province is burning up. So there's a lot of other factors that can contribute to these kind of worsening stats that we should acknowledge, because at first I thought, geez, are we failing? But there's a lot of other factors that they're not in our control, and it just feels like traditionally we thrived with what we had, and now we're just basically in survival mode. Decades and generations of our people are just in survival mode. So it kind of brings me to all of the strengths that we have to be able to turn things around, and Winifredine really referenced some of those, like all of the wonderful things that are healing to our people, like our ceremonies and culture and our food, and so we have a lot of work ahead of us as usual, but that we have a lot of blessings and things to be grateful for in that work. So one of the questions that Dr. Bonnie Henry mentioned, how do we measure healthy, self-determining Indigenous people? And I just want to kind of end on this note. One thing that I find is a real good indicator of a healthy community is the kindness and the lateral kindness that is happening and are changing in the communities. So the lateral violence seems to be diminishing in a lot of ways, and that, to me, that's an indicator of healing, and one of the main indicators. And it's kind of a different way of thinking, but I just wanted to share that with you all today. So on behalf of the FNHA, I really value this alliance that we have, that we share with one another, and it really brings us together in the best interests of the people of BC. So I wanted to, just acknowledge this structure that we have, and it feels like it's working, so that's good. And I feel like I'm taking too much time, so I should stop there. And yeah, just thanking you all, and happy Friday to everybody. Take care.
Thanks, Janice. And I think I'll just say one thing before I turn it over. I think with the disappointment that some people have expressed around, seeing that many of these indicators have either shown minimal or no change, or have decreased or gotten worse over time. I think it is to a certain extent how we're measuring things, right? These indicators were part of the original Transformative Change Accord, and we did mention that, we are looking at other ways to capture health and wellness. So there's some limitations to the data, for example. There's some challenges with, getting updated information. So some of the data that we're presenting right here in 2024, the actual data is from, as you saw in some of the charts, back to 2021 or 2019. So, and we have been through quite a bit when you think of it, not just, among First Nations in BC, but in the province and the country and the world, with a global pandemic and things such as that. So, the work that we're doing, for example, with the We Walk Together, the We Walk Together project is one way where we are looking at indicators of health and wellness in a different way. And like you said, telling our stories and recognizing what we know to be true is that good work is happening in communities, and that there have been positive changes. They just don't happen to show up in these 14 or 22 indicators that we have. So I would encourage everyone to, feel what you feel. As Winnick said, please look after yourselves, but absolutely we recognize all the hard work and effort that goes on at a variety of different levels, at the community level, at the advocacy level, at the political level. We all are working toward the same thing. And I think that, as time goes by, we will start to have some indicators that show different places where we are improving and where people's health and wellness is starting to show improvement on a population level overall. I will make one brief comment that there were a couple of questions or comments that came in on the chat once we finish the Q&A portion. We will definitely get back to you with responses via email. So don't worry if you've put a question into the chat and that hasn't been answered. And lastly, I think we'll turn back to Elder Sequoia to close us off. I just also want to express my appreciation, Sequoia, for you being with us here today. I know for myself, I haven't seen you in person for a while, and I do miss your Jedi knowledge that you share with us. But it's really good to see your face, and I hope that we see each other in person soon.